Integrating risk communication and community engagement in outbreak response is essential for addressing potential challenges to the acceptance of public health measures. To do so, humanitarian actors must partner with communities, understand community members' lived realities and perception, leverage their capacities, and adaptive interventions to the local context. Oxfam is using a simple mobile technology called the Community Perception Tracker to capture community voices and involve communities in the decision-making and design of multi-sectoral response programs. The Community Perception Tracker keeps affected people at the center of an outbreak response. It makes connections between the community, management teams, coordination mechanisms, technical sectors, national authorities, and global and national advocacy groups. It is a practical tool that helps national and international organizations and their partners actively listen and respond to communities. It also provides analyzed data to share with communities, engaging them in response planning. How does it work?
Hi, my name is Raisa Adzalivi. I'm a public health advisor for the Global Humanitarian Team in Oxfam. Basically, it's supporting staff and partners team while they are actually conducting their activities, their normal activities, and using a mobile phone to be able to capture perception and perspective from communities on that specific outbreak. Uploading into a system that will help us to be able to analyze the data. After the analysis is about how to translate this analysis and interpretation of the data into action. So how are we going to use this data to adjust our programming or to advocate on behalf of the community? It's thematic and ongoing, and it's alongside the projects. So what is it not? It's not a standalone project. It is not a survey. We are not asking a specific question. We're not coming with a specific agenda in mind. We're really looking and having this active listening of what people have to say about their perspective, their perception on how they feel about the actual crisis they're going through.
We started seeing that our programs could actually be designed through what they are saying. This whole idea of us looking at how people can actually become decision makers in things that affect them, how they want to receive the aid, but also what kind of aid they want to receive, and how they want to be involved. This is the part that I would say made the most difference. I'm always giving the example of the vaccine promotion campaign because it actually came out of one single perception. Before the issue of vaccines was accessible in terms of information in Lebanon. With this perception, we felt, okay, there's lack of information. People are going to start asking questions. We're not ready. How do we do that? We don't have the information. And this is how it all started. It was one single perception. So we did receive a lot of flexibility from our donors on facilitating access to vaccines before it became available to the refugee community. So we were prepared, and this is what helped us move forward with it quite quickly.
How does the Community Perception Tracker improve integration during disease outbreak planning and response? It systematically captures informal data and translates it into purposeful evidence that can inform programs and the design of holistic, people-centered humanitarian services. It enables rapid analysis and provides real-time data and reports for use during multi-sectoral and donor management meetings and for coordination and advocacy. By feeding the reports back to the community, it supports community leaders to design their own integrated action plans. To learn more about this and other integration stories, visit READY's website.